Joining me now is Erik from the Ottobock company. They are a leading German company, a leading international company for prosthetics. And Erik is head of their patient care centers. Thank you very much for joining me.
Pleasure to be here.
Mr. Andres, Ottobock was very much involved with the Paralympics who have just ended. Can you tell us a little bit more about that involvement?
Yeah, since start of the Paralympics, we are a technical provider in Paralympics. Just yesterday, a big team colleagues came back from the Paralympics. It was a 100 people strong team of prosthetists, orthotists, therapists even, and they did more than 2,000 repairs, new productions of prostheses, orthoses, and yeah, they took care of a lot of patients, even for patients with non-Ottobock products.
And was some of your work used in the Paralympics actually?
Sorry.
Was some of your prostheses used in the Paralympics?
Indeed, they were used. So the current fastest human on prosthesis is fitted in our patient care center in Duderstadt, Johannes Flores. And again, this time in Paralympics, he was gold medal winner on 400 meters in a time of around 44 seconds.
So I congratulate you that sort of your prosthesis was part of that win. You've brought something with you. Can you explain what that is? Maybe lift it up?
So this is a typical, let's say, sprinter prosthesis with an Ottobock knee joint. This knee joint is the only knee joint in Paralympics. So in case of transfemoral amputees used for sprints, the only knee joint what is used there. Here you see a carbon fiber foot. So it's a carbon spring, let's say. It consumes energy and gives it back when toe off, let's say.
Wow, so you help the Paralympic athletes. You would also help international patients if need be, obviously, in your patient care centers. Can you tell us a little bit more about that?
Yeah, so in two patient care centers in Ottobock headquarters, this is located in Duderstadt in the center of Germany. The other is located in Berlin. So we invite international patients to be fitted from prosthetists, from specialized prosthetists, orthotists after amputations. As well, we do the therapy, so we are not just delivering the car, but the driving license as well. So we do prosthetic training, let's say, after the treatment, after the fitting, the technical fitting, we train the people individually, so for their individual daily life after the fitting.
Okay, that's very interesting and time-consuming work that you do. I think time is always a factor. During COVID, I'm sure that some of your work was sort of delayed and it had an effect on your work. Can you tell us what that meant for you as a company?
Yeah, it had, and currently still it has still an effect on our work. So first in the first phase of COVID, there were a lot of travel restrictions internationally, everybody knows, and for us it made our profession work very difficult. So the first point was, or the first difficulty was international travel restrictions, but then as well, so the visa application for our patients became difficult. With the influence of Corona, still with the influence of Corona, and so I'm happy to say that it's slowly picking up again, and so that we can do our work what we used to do before COVID.
Right, so thank you very much. Let's hope that you can continue without COVID interruptions in the near future, and thank you for taking the time for this interview.
Thank you very much.
Thank you.